My name is Patricia SANTOFIMIA. I'm a Spanish veterinarian, and I performed also my PhD in Spain. And then I decided to move to Marseille, to the CRCM, to perform my postdoc. So under the direction of Juan Giovanna. So I get very involved in the project. I was very happy to be here. So I decided to apply to the competition of INSERM. And since 3 years ago, I hold a tenure position as a researcher in the same team. And I continue my work in pancreatic cancer with Juan Giovanna. So our goal is to develop new therapies against pancreatic cancer. Pancreatic cancer is a very aggressive disease, so there is an urgent need to find new therapeutical strategy for the patient. So my goal for this project is to find new therapeutical targets in order to better understand the function of these proteins in the pathophysiology of the disease, but also in the most translational part of the project to develop inhibitor of this protein in order to develop, to incorporate new compounds in the chemotherapy strategies for the patient. Also, we are very lucky because there is a startup, Panca Therapeutic company, that is helping us to translate these compounds from the bench, from our laboratory, to develop the preclinical assay in order to translate these compounds to the clinical assay with the patients in the hospital. It is very important, it's very interesting to have a department such as Translated because it's giving us the opportunity of a very collaborative and interdisciplinary environment in order to translate much more easily our work in the laboratory to the clinicians and finally to the patients. The important point of our department finally is to develop something that the patient can benefit from it. So the patient can benefit more quickly from the innovative therapies that we are developing in the lab. Fortunately, also in 2024, we will be moving to a new facility, a new building that is totally dedicated to study pancreatic cancer. So the name of this building is Fight Cancer. And it will be very nice to be so close to the hospital and to the clinicians and to the patients. Creating a new department like this that clinician, basic and fundamental research are collaborating and so on, are creating new knowledge, but in a very multidisciplinary department. So this is very enriching because we can develop new knowledge in a very collaborative department. So this is beneficial because we can improve also our professional knowledge, personal knowledge, and the project can be seen on a different view from a clinician, from a fundamental scientific. So it's a very synergic way to develop science, and in this way we can remove the walls that used to be between basic and translational and clinician researchers.